What's up, y'all? Welcome back to my channel. Today I'm gonna be taking y'all with me to my dermatologist. We're gonna do some investigation and look into what is exfoliative cheilitis. I'm gonna be taking y'all behind the scenes. I got my cameraman pulling up and he's gonna be shooting scenes for the documentary. So it's gonna be an interesting day to say the least. Y'all stay tuned, stay with me, you know what I mean? And let's get to it. Alright guys, so I just arrived at the spot. Waiting for my photographer to come in. It's about to rain out here, but this is the building right here. We about to go in, so should be good.
Buenas tardes.
Buenas tardes.
¿Quién?
Cita. Hold on.
La reina.
Hello, doctor.
How are you doing? Bien.
I appreciate you allowing me to do this. Like I said, I'll be quick, but I just want to get some stuff. I'm shooting a documentary on my life, and this is the cameraman for the day. He's gonna help me.
Okay. Si querés vamos por acá. Dale.
You wanna know? All right.
So you prefer to do it like in the...
This is gonna be for my vlog.
Okay.
But he's gonna be shooting it for real footage. That's gonna be in a documentary. That's why I needed a professional.
Okay. First advice will be to see an allergologist, you know? Because when we talk about cheilitis, we talk about a condition that is peeling your lips, right? And the most frequently cause is allergic dermatitis, right?
Okay.
So it is more frequently in women that can be for allergic contact dermatitis, for use of
lipstick, lip balm,
yes,
something
that thing that women use to put some color in your lips.
Lipstick.
Yes, I don't know. Lipstick is the name?
Yeah, in English, lipstick. Yeah.
Okay, so tell me to be like in a formal condition. I don't want to see you to look like.
But how do you want to do the interview, Ray? Like you talking to him?
You're introducing it to the world. Most people don't know about it. You're a dermatologist, so maybe you have a bit of history about it. But I'm sure he's probably never heard of this. Other people's never heard of it. It's rare that I run into somebody that actually has the condition. So that's why I'm just trying to educate people about it. Put it out there, try to get some help, get some answers to it. I've seen an allergist doctor. They do a test where they like mark your arm and they ask you like, okay, are you allergic to this? Are you allergic to that? No reactions. So
you have no reaction?
No.
Yes, and generally exfoliative dermatitis or exfoliative cheilitis is an exclusion diagnosis. So after you do like certain types of exams and you don't find a diagnosis, you start to think maybe you have exfoliative dermatitis or exfoliative cheilitis, right? So it's not a diagnosis you do at the first time. It's a diagnosis you do by exclusion of other conditions, right?
So
that's the
seeing
name.
an allergist, I've seen multiple dermatologists in the States or different places. Some of them were familiar with the condition, some was not. So like they may prescribe an antibiotic or something like that. But the biggest thing is I just want people to understand what it is. It's not an easy type of cure-all type of thing. Take a pill, take a this. It may work for some people, it may work for other people, but you have to get to the root cause of what's causing it.
Yes, and actually cheilitis is a generic name, you know?
Right.
We say cheilitis for a condition that is peeling your lips.
Right.
Some have descamation, some have some redness, but there is not like a clinical condition that can you certainly do you have exfoliative cheilitis.
Right, well this would be the name that is the most resonant for me because you have actinic cheilitis, you have different type forms of cheilitis,
That's
but
right.
because mine is the peeling kind and it's been chronic, And
I've been
through the
performing
allergen,
a lot of exams
exactly
for for getting a cause, right?
For sure. So like blood tests, different. Well, you start there first.
Yes.
If you see changes in your body, of course.
I think we should do an exam. One thing that we haven't done, and I think will help us, is lips biopsy. You know, that is take a little piece of skin and send it to the pathologist.
Right.
I think that will help us.
Right. The only hesitation I had there was it wasn't the skin; it was actually tissue. So I don't know how that'll look or heal. Like you're taking tissue, not
Yes.
just the skin.
No,
Right.
the tissue is the skin, and all the parts that are forming your skin. You know, you got the epidermis and you got dermis, and you send it. You take it with a punch,
Okay.
and you put a stitch. After that, and you send that tissue to the lab. So I think we should do that.
Well, once again, I appreciate you sitting with me and giving me that information and giving the camera that information.
Okay, no problem.
I
mean,
And
we are trying to help you in the best way. Like
Yeah.
I told you.
yeah,
I mean, this is an exclusion of diagnosis,
right.
and unfortunately, we don't have a cure for that. You know, but we have some treatment that can help,
Right.
like moisturizing. Some patients respond to topical steroids,
Right.
and there is another treatment like tacrolimus ointment, and it can help also.
Yeah.
But nothing.
Without
I
the
can
reason
sure-
for
I can
it,
sure-
no, just take this and it'll be
Nothing I
fixed.
can sure it will cure your condition.
Gotcha.
Because sometimes when we treat people, almost big part of the diseases, we like medical doctor,
Right.
we don't cure. We treat
Right.
psoriasis,
No, I appreciate
No cure for
your
psoriasis.
honesty. Yeah, and that's the thing.
vitiligo,
Yeah.
don't cure for vitiligo.
Yeah.
So
For sure.
we got diabetes. Have you heard about cure of diabetes? There is no cure.
But I also
So,
think that there may be people that don't like cancer, diabetes. These things are more common that people know about. You get what I'm saying? Because I
Yes,
think
yes,
there's
of
more-
course. They're more frequently.
Is this type of condition a rare a condition or common? That's what I'm trying. Is it more rare than common that someone
It's
would have?
very
it?
rare.
It's very rare. That's
Yeah.
another thing. So I think that because it's very rare, the treatment is still being discovered or ongoing, or even doctors that even know about it.
I mean,
it doesn't take precedence
Yes,
over
it is.
major diseases. You get what I'm saying?
Yes,
So
I
the
understand
quality
what you
is
say,
like
but,
to the person dealing with it, the quality of life is suffering. But there's more people that have real, I would say, I guess more urgent that they would seem like if someone had a malignant form of cancer or something like that.
yes, so-
That takes precedence. You know what I mean? So in the scale of the medical community, they don't look at this as such a grand thing. You get what I mean?
Yes, I know.
Okay.
I know. And well, I mean, we can, like I say, for now, doing some hydration, moisturizing of your lips,
Yeah.
and topical steroids, and nothing more about that.
Yeah.
Yes, we can do,
Yeah.
like I said,
And that's pretty much up to you. I mean, up to me as the patient to keep looking. I understand.
Yes,
you
yes,
can
yes, I
do
know.
what you have
And
to do, but
when you say to me, no, I want to try antibiotical
Yeah.
oral, I don't think that's the solution.
Yeah.
And it will not be the solution.
Okay.
Because you don't have an infection for
well, that's
fungal
what
infection.
the punch would show, right? If we did the biopsy, what would
No,
be the benefits
the
of doing the
biopsy-
biopsy?
Actually, the biopsy will help us to rule out some other conditions.
Okay.
Yeah. There are conditions like plasma cell cheilitis.
Okay.
That is like a condition similar to what happened in the genital part. We call balanitis. That is a plasma cell,
Okay.
and we got plasma cell cheilitis. That is something similar, and we only can rule out by a biopsy.
Okay.
There are conditions that affects the
The vermilion border or the total lips?
No, the salivary glands.
Oh, okay.
Minor salivary glands.
Yeah.
In your lips.
Mm-hmm.
That can
be ruled out.
Be like a cheilitis that can be ruled out by a biopsy. You know. But I will say you have been performing the contact dermatitis test. And
which was what?
The things you told me, you went to the allergologist.
Yeah, I went to an allergist, yeah.
And you've been with this disease, with this condition, like
years. Yeah. It was a gradual change, and then it was
types of.
Well, I've never done the biopsy. Nobody even recommended it. I've never done the biopsy. No.
Yeah. Well, would be a good idea if you want to keep going in this.
Yeah, I mean, I'm not gonna stop. I want to see if there was a change in the body, because it could be, if it's not that, it could be a sign of something more serious. Who knows? Like, the body doesn't just change overnight, right?
I don't think it would be more serious.
Well, you never know. You know.
No,
you never
of
know.
course you never know. But well,
yeah.
I think that's basically.
No, I get it. I appreciate your time speaking with us today, and I just wanted to get that. So guys, that's pretty much it for the video. Like, I appreciate the doctor for taking his time out to speak with us. If you enjoyed the video, remember to like, comment, and subscribe. And also, like I said, I'm still continuing on this road of trying to figure it out, but you guys know a little bit more about exfoliative cheilitis. All right, take care.